This is Senate Appropriations, April 10th, and we are continuing our work on the House passed budget, or I don't even want to call it that because we're really going to be developing sort of our budget in the end. But we thought it would be helpful to start out with one times. We've got a lot of competition for base spending, and base spending is what's going to require revenue generation. So that's where we're going to be in a very different place than the House. So if we want to start at the top, Emily, and if you just help us walk this through any of the ones that we just say we want to close out, we agree with, we'll do that and take it as we go along, and things that we want to keep open, then we'll have further discussion. I'll let you take it from here.
Sounds good. So for the record, Emily Burke, the joint
I must
fiscal
be
officer.
missing something. With all the people in the room, I would think I'm making momentous decisions, but I think we're just grinding through, so. So we will, you do.
Well, I had no time to be, that would be up.
Yes, this is fine. You're gonna agree with everything I agree with. I'll make it
Particularly
simple.
the startup cost for the psychiatric youth and patients.
Yeah, okay. All right.
Okay, so on the top of the page, the blue header and the lettered sections, this is the one-time revenue that's in both the governor and the House approved budgets. On line A, the first one is what was available, or what's projected to be available at the end of FY 2024 that will be carried forward into FY 25. As we discussed yesterday, this number rate assumes that you take all of the changes in the C section, or that's what's in the House version. All the changes in the C section, so the child care change, the money for the summer
The
EBT.
24, which we kind of closed down.
Yeah, and the difference between the governor and the House is the Budget Adjustment Act, which was all of those appropriations for the flood impacted communities, so.
We're starting out with less money.
Starting out,
Would have been starting out with a lot less if we hadn't pulled all so much of it out. So, okay.
Yeah.
So the governor, but the governor's 59 includes all 9 childcare.
The governor
Yeah,
included all the 29, and we spent some of that, and we used it all. So that's where the $15 million change is.
Yeah.
Four.
and so the House then did a reversion from the tobacco fund for the TINS appropriation. They took $3 million from that, and then they're reinvesting it. You'll see it below in the CCWIS system.
Yeah.
Additionally, they reduced the funding that is set aside for ANR IIJA match in one of the sub-accounts in the cash fund. There were a couple other.
And I wanted, I'm concerned about that because we wanted to make sure we had the reserves to draw down all the federal money. And we've heard from the administration, they're concerned about that change. My question, if has anyone explored with the secretary regarding, is it 5 or is it can we not, do we have to replace all 5 based on the current estimate of what is the match needed? And
We reached out to the secretary. I think
do we have an answer
we
yet?
have an answer, but I haven't looked at it yet.
Okay, all right, I wanna hold that.
Yeah.
Senator Ingalls indicated he thought that, rather than 5, having all 5 replaced, they we need 3, but I'm not sure, so I'm gonna hold that.
There were a few other reversions that we went through yesterday.
And we accepted them, I
Yeah.
believe all of them. If we didn't, but I thought we did.
I think you do. And then the last piece, is the reversion for the pension plus payment. This was not included explicitly in the governor's recommended budget, but to show sort of that they had a plan to pay for it, wanted to make sure that it was included
Yeah,
here,
we
so.
made it just more transparent, but
Yeah.
didn't add, okay.
So that's the revenue, so, the governor had 72.21, the House had 65.69, for one-time investments. So in the next section, I will walk through the one-time appropriations. As recommended by the governor and then adjusted by the House. So the first one is the state match for FEMA funds.
So I think we agreed with that, so let's close that.
That additional 12.5.
Yes. Yes, it's a different 12.
Right.
It's got to be the same amount.
And this one is for,
The military
hazard
support group
mitigation.
for the USS Vermont and it's a. So
So can
I
you just ask the FEMA match is for what pieces?
for hazard mitigation.
For hazard?
The next one, the renewable energy standard reform, this was included in the governor's recommended, removed by the House. It was removed by the House because my understanding is that the renewable energy standards bill that was passed would result in the need for the studies that were funded with this.
That's for further discussion on that and I think we came to the same place the House did in light of the change to the bill. So we can close that out. Startup costs for the psychiatric youth facility. And that's the retreat. Is that the retreat or is it Bennington?
I can't remember which one it is.
So Brattleboro.
I can find out.
Is it the retreat?
I think
In-
it's in Brattleboro, that would be the retreat.
It would be the retreat of the Bravo. Does that need to go through? Because, Representative Donahue caught me and said something about, thought it would have to go through licensing or something. Can't remember. Was there language in the big bill?
Wasn't there language after, was there language after an amendment related to licensing for Brattleboro? I think there was licensing for Brattleboro.
I think so.
That
Yes,
was added.
that's the Donahue.
Yes.
Yeah.
Was that passed?
Yes,
So the language is there.
yes.
Okay, well, she spoke to me about why it was needed and originally they thought it wasn't required and then the CMS said yes.
Right, so there's no,
So I think all she was saying is why that language is there and why it's important. All right, so I think certainly we know that's a great need. Bridges to Health, that is, providing healthcare to, I believe it's undocumented individuals in the state. So that's something that, has been put in place and Department of Health provides that. Want to close that out? I think that's a continuation of.
Yeah.
Now, this is the household insurance survey. We really use that to track how well we're doing and we make the percentage of Vermonters that are uninsured. Something that we've been doing, I think, since maybe the 90s. It's been a long time. So this is continuing an update on the rate of insurance coverage here.
And do this how often?
I don't know, it's every 3-4 years, I think.
And that's what it's on one time.
Yeah. So I think we'll do that for now. GA emergency housing, yes, that's
Does that gets into the whole,
it, well, this funds at least what the governor's proposing. What the House passed is much more expansive, adds much more in the way of days. And so I think there's no choice, we need this. The question is how much more and what version, we're going to accept. Well, it's for next year.
so the money is spent, we're gonna spend it on that, but we don't really know what the bottom line of what we're gonna spend.
A lot depends on what we agree to on, policy parameters, how long we're gonna continue a program that got started in COVID and revert back to the prior, program design. And so that's still open. We haven't made any decisions except at a minimum, this is what you need to support what the governor's got. The question is how much more? And so
The GA bill currently begins in 26, so. But,
I will say I am very worried, this practice of getting the camel's nose in the tent and then say, next year, it is very similar to what people did in deliberately underfunding pensions and a variety of other things, and that is, we'll put out the commitment, we'll worry about the funding later. And, or we'll annualize it, or we'll do it for half a year, or we'll do it for the last quarter. And it's, I call it camels in the nose tent budgeting. And if we're gonna do it, we need to be very clear, because we're building an obligation in a base. So, I don't, the same thing was true with, I hate to say it, with S18. Well, we'll delay it and have that revenue loss out in front. So
I don't think that relates. I don't wanna get into that.
well, it is, it's,
No, it doesn't.
it's deferring a revenue or budgetary impact. Well,
How do you, how we?
well, I thought
We
they,
have to talk about that.
no, I don't, I'm talking about delaying implementation
Okay,
and the implications of doing that as it relates to the bottom line, that's all. So on the GA emergency housing, I think this is the minimum. The question is, what else goes with it? Senator,
In the House, they didn't put any more in the budget, they have that other bill, and is that all the other money that they had for GA is our reversion? Or did they have other?
they have the one time here, and then they also have a contingent appropriation of 20 million.
They don't have any, so that 20 million is all they have in.
And then
So
And the
seven,
governor had added to the base. Last year, we added 7.5 to the base, and I believe the governor's proposal was 7.2 or something like that to the base.
Then that's all, and that 20 million is their first, top of their contingency.
Yeah. So I think no one is saying the 16.5 is too high. So, this is just the child welfare that's being funded out of the, CHIN's, appropriation. So if we agree with using, and that money was designed to help improve our child welfare system. DCF, extended 10 limited service, and that has to do to support emergency housing. And the governor had it and the House did. I don't see that we're gonna get by with less. The 211 contract, Senator Sears had some discussion around it. That was to, get after hours. I think it was from 11 overnight and, yeah, Senator Persley.
I did talk to them today about more information, that it wasn't just housing, that they get a calls like law enforcement and other things that they get during the nighttime hours. And it used to be nighttime, which I didn't know. I thought they wanted to expand that.
Oh.
If we want more information, they said they've provided this.
It's emergency calls after hours.
Well, I think the question, yes, it's,
Somebody should be.
well, Senator
They
Sears,
said sometimes that 11 daytime is when people are in crisis. That was their argument for why.
who is there, the 211?
Yeah,
Well, we can, do you wanna,
Hold that.
hold it, or do you wanna,
like, I didn't remember all the dollar, like this 0.33 gets, that's just like is that extending it, or that was just to hold them with this?
no, this
for
is to
other-
allow the after hour coverage.
So this allowed,
This, that's currently not being covered now, so I understand. We can hold that if you want.
but they said they would give us some more information for us, if the committee would. Stay in.
Yeah, okay, well, we'll hold it.
Okay.
I mean, I have nothing against 211. Gretchen Morse and I put the damn system together, so I want people to know that I'm not, an opponent of, the coverage, or the service, so it's just a matter of, we originally heard it was for dealing with housing, and people were saying they weren't accept, after a certain period of time, there wasn't a ability to house somebody at late hours of the night,
I
so
would think.
that's what Senator Sears was talking about.
Yeah.
300,000, I mean, if you have an emergency, and you need to call 211, there's nobody.
Well, this isn't 911. This is 211. This is United Way. This is not the emergency service operated by this, by public safety.
I would just say that, that would be looking at the 330,000, that the minimum what they need, the system needs some help.
Well, this is one time. Just remember, this is one time.
Yeah,
I think they got some help last year, didn't we do some of it last?
Last year got totally overwhelmed with it. So actually, I think they brought in additional support.
But I thought we gave more money last.
But
think so.
you may have given them more money, but over the summer and with the floods.
Oh, yeah.
They got pounded with that, so they've got some catching up
I
to.
think they said that they ended the nighttime right before the floods.
So I'm holding that and we can get more information. Vermont State Colleges, this is, I think, based on our past history, this is the 10 million, bridge funding. It's part of the transformation plan. And, just like last year, we did the 15 million and our argument was, promise made, this has nothing to do with the base or the deficit target. This is just the one-time, commitment, bridge fund.
Well, I totally agree with the bridge funding and this is what we promised. But they do have a request in the base to increase funding.
Well, that's a separate discussion.
Well, it's a separate discussion, but if we can't do anything for them in the base, I'm not sure I wouldn't want to give them a little more here.
I'm hoping we will be able to do more for them in the base and connect it to the deficit reduction.
So I'm,
I'm just saying that it's hard to make a decision alone on this piece
Yeah.
without knowing when you get to the base, if we can do anything.
well, that's on our list for base increases. So I think we can at least agree, sort of like with the housing, we're talking about, what is, at least, making a decision in terms of being clear, of what we're committing and how much more we can do, will be, determined. So. And I do have, if anybody somewhere here in the pile of stuff, I did go back and get a copy of that, transformation plan and the, increase to the base over the multi-year period.
I had one.
Well, I've got two copies and I can't find it, so it's here. So we'll close that out. Question is, if in fact there's more that can be done relative to either that 25 million deficit reduction target. The CCD tuition advantage program,
That's what-
yeah, that's the one I'm looking at. Okay. Match for the Winooski study.
What's the next study?
Word up,
I'll Google it.
I forgot.
Yeah, it's,
It's a federal, water.
Resources Development Act.
Yeah.
I think that's probably important, Winooski, and one of the major,
For federal match, yeah.
right here, I've got a copy. Now that you found yours, I found mine. Seems like, that is something we need to do. It's part of, sort of, the Winooski seems to want to flood a lot of either Waterbury, Montpelier, and so forth. Continue, this is the Healthy Homes. And,
Yes.
this is the program operated by ANR, and it's to provide assistance, and they've had a very strong response. These are to help low-income homeowners whose wastewater or their water systems, aren't functioning. And, the governor was recommending for, the House, cut that in half. I would like to see if we could keep it at the 4.
I'm with you
yeah.
on that.
Well,
After
I'd like
talking
to too, should we put this
A&R.
on hold?
Well, we can, if we, I don't think we're holding it to have further discussion about what we want to do. The question is, in the end.
How high should it be?
Yeah, and
We
so.
can put it in at 4.
If we put it in at 4 now, just to say that's what we would like to do, then, capital loan, that was the one where you just had to prove you spent it and you got your loan forgiven. That is not going anywhere. I do not believe at this point, so, that was one of the governor's proposals that came over. If you remember, that was a bill and, Keisha, from Hinsdale, that she was pulling it back. And it was one where all you had to demonstrate was you made the expense. And people were not happy about that, so I'm gonna leave that the way it is until once we hear something different. The international office is to continue our work in Montreal to support Canadian businesses, set up a presence in Vermont. So I think you want to agree with the House there. Manufactured home improvement. In VHIP, and what the House did was pull that out. And I'm gonna hold those because I've given those to, our housing committee to look at, in terms of the prioritization and so forth. What the House did was pull out the governor's recommended funding in those areas. Manufactured home improvement, that's really for repairs for particularly mobile homes. And then VHIP has been very successful in getting apartments online. So I'm gonna ask that we hold those pending further information from our housing committee. Vermont Access Network, I'm going to hold that because we have been giving them one time pending getting something for, an ongoing funding source to make up their loss where they got the money. And that is the, bill that we passed on streaming. And so if, in fact, we would not be doing a one-time bridge because we've dealt with the longer term.
It's still in value, that would just be paid, or maybe not.
I don't know.
This,
Are
you talking about down at the bottom, that's 181? Or not? Oh, because the streaming tax improvement.
Yeah, right now, this is one-time funding, which is a continuation of what we've done for the last couple of years. But now that we've got an ongoing revenue stream, well, we need to determine out of that how much to appropriate. If we did it one time, they were proposing $1 million would be sufficient. I don't know whether $1 million, I don't have a sense of their budget. I got something that maybe it's 3 million, but our purpose here is to maintain the current level of service and how, what that level is. I think we need to have more discussion. I think joint fiscal is looking at that, and so it definitely needs to come off the one time. The question for us is how much out of that revenue from streaming would go to support public access television. The elections, this is 300,000. I think we have to do it. That goes with hopefully most of the 500,000 will be left from rewarding school districts. OPR, once again, this is the cost of implementing more of the compacts, which have been on Senator Lyons, you've been involved in all of that. So this is to help OPR set up these new compact agreements. All right. This is Forest Parks Recreation, and this has to do with the $1 million that we have gotten from the loggers. And we've had some discussion because it was not clear exactly what their priority was. And Senator Perchley has had additional conversation with Sam Lincoln. And I met with both Sam and Dana Doran. And they are saying that their top priority is the education and the other parts of it, not the business, impact that they've had due to the flood. So, I think,
It's not really education, it's a grant program to help with their infrastructure in the woods, so they.
in the woods, but there was also loggers, education and certification, master loggers, I think, yeah.
That might be.
Yeah, I think that was part of it. And so, do we want to close that out? That's a recommendation, I assume, from ag as well.
Well, you guys,
Okay, here's the next one, ag, cash crop.
that's a 3-to-1. program.
All right, so that's, the House put in 450, and I have been led to believe that maybe ag wanted to look at that relative to what the governor proposed for the conservation
I
districts.
think, I think both Bobby, the conservation districts, need to be in here.
Yeah,
And so the way the governor's budget was constructed would end up with a reduction of 112,500. Over
Of the
what they,
percent come from who, from the districts.
yeah, district, and of course, they wanted 3 million.
yeah, that, they should be
So that,
back to where they, at least where they were.
do you wanna talk to us and give us something more specific, or,
Yeah, we can do that.
and this is one time though,
Yeah, well.
this is all one time.
Better than skunking on it.
But what we should do is do one time on this item 23.
Well, my
And
question is,
do-
if we wanted to give the conservation districts base of what they got last year,
That's,
then we would need to add 112 to our base request list.
Yeah.
This is one time.
yeah,
So-
so this will keep these programs.
This
Three.
doubles the program, some of them.
Well,
I thought that's what you
why
said.
don't we talk,
Yeah,
because
we're
I,
coming.
the conservation districts are, I think, our top priority, would you say?
Well, yes, but you don't want
We
to
don't
put
wanna-
$2 on the table for a dollar spent either. So
Well,
we'll figure that out for you.
my only concern is what we're finding is because people got more money and we were able to put more money out. All of a sudden that becomes the new base as opposed to, this was an opportunity to do something more than we would normally be able to do, but it's not gonna be ongoing. That's how we view it, but we're getting it back. You're giving us a reduction. And so the more we do on the one times, the only caution I would give is that these are one times and they don't constitute your base or future obligation at that level. That's the only thing I can say because it's sort of like the discussion we've had with transportation. The minute you set that as the funding,
450.
the House put in 450.
We could do.
Well, you can talk about,
250 and then, well, let's talk about it when we get out of it.
urgent care centers, this is once again, this is one-time money. And then we got the testimony from the department that more of this money would continue, grant money through next fiscal year. These are, actually, it's like mental health crisis services. And I think if we're gonna do some, these are services that are currently provided. And the grant money to do it will go through next year. This is one time. My recommendation, based on our discussions, is that we not deal with this on one time. We look at the extent to which we can do some kind of increase to our community-based providers on an ongoing basis. This is a one-off, doesn't help with that financial stability. And so it's with that thinking that the grant money seems to be available for another year. So I think a one-time relative to doing something with the base, I would pull this off and look what we can do to increase just the base reimbursement. Um. Okay, Medicaid Global Payment Program. Um. What this would do is, if you remember the testimony, as part of healthcare reform, payment reform, is to, the proposal was to have at least 5 or up to 5 hospitals get involved in a pilot program to go to a global budget alternative. And what this is the tail. So once you make that global payment up front, you still have got claims on that individual in the pipeline yet to be paid. The 3.91 is paying the tail claims. And this would be, as Emily reminded me, is a permissible use of what used to be what we call the caseload reserve, but now has been renamed. And so what I put on here is that we want to keep going. This seems to be a very very important part of our our payment reform, looking at cost containment and because it's a one-time expenditure, it would be permissible. And last I knew that reserve had about $90 million. But it's for very specific reasons. This would be one that would qualify. And so I would recommend that we support that payment reform and put in the 3.9 one time, because the tail payments are a one-time enough.
Do we know why the House didn't?
I don't know, but I don't care.
Understood. I was just wondering if there was a rationale.
I have no
I
idea.
don't know what. Figure out.
I think at that point, no, I suspect at that point, and which made it easier for us, is that in fact, once I understood that it was a one-time expenditure, that it wasn't necessarily an ongoing obligation as part of the pilot, and it was funding the tail claims, and that would fit under the caseload reserve, it made it much more doable, and I think that probably that information may have not been available or at the time they were doing it. So as they were trying to bring the budget in and look at what they had to work with, I think that's why it dropped off, not because it doesn't have merit. It was just, where do we find $3.9 million? And
They named all 3.9.
yeah, it's a lot of claims for 5, if they did up to 5 hospitals. So that doesn't, fortunately, it's not on ongoing base general fund obligation, and there's a reserve there to support the payment of these healthcare claims.
So you're suggesting,
I would say you would agree with me.
and you're in agreement with the governor.
There is no other.
The governor actually was not using that same revenue source.
The dollar.
Yes, yeah, because that came from Viva.
Right.
I don't think the governor probably calculated it himself.
I didn't want to suggest you agree.
All right, the vacancy savings. I think there was great consternation. Remember, we got it, well, we're already booking 57 million, so it's a terrible situation, so let's add 5 more to it. And I do think we've gotten communication back from the administration. And the irony is that the union has been very concerned that somehow we're arbitrarily keeping positions vacant as a way of saving money. And we say, oh, that's a bad practice, and yet here we are doing it. So I would suggest that if we can find a way of addressing that revenue, that we not artificially impact the workload, the workforce, or the workload that we've got out there. So I would not agree with the House on that, and we can look at how we make that work. The pension, that's just making the pension payment more transparent. It's not changing the money at all. And we have to do it. That was part of the negotiated agreement with the annual plus payment. DLC, this is the ARPA swap, and we're gonna add language to make it clear we've debated back and forth whether that was ongoing, whether it's basically that they'll move somewhere else. And the conclusion was no. So, we know that in order to make sure that we use the ARPA money up, we can use it for payroll and that would then free up money for other purposes. And we're gonna add language that Doug Farnham, we talked about, and that is, this is a one-time adjustment and in no way is, the underlying base being reduced. And he indicated yesterday when he was in, that it could happen any place in state government. So we just wanna have that very clearly stated somewhere in the budget, that is not our intent that any of these swaps result in a base reduction for anybody,
For whoever.
yeah, including.
Well, so if there was more ARPA reversion for the contingency, would it go through the same kind of swap? Or would it stay as ours?
Basically. It depends on how you wanna use it, because there are parameters around how you get,
Yeah,
the
why-
other is the time frame. The other is the timing.
right, I just assume we want to put it through this process if we could, if we had the ability to do.
Yeah.
So we could just put that same language in the contingency section or around those contingencies.
I'm not sure exactly where we will put it,
Okay.
and
I just wanted to flag it because I didn't,
Looking at fun.
I was just thinking about that.
no, it's not in the House Pass version at all.
Right.
We haven't seen it yet.
Because if you do that, the 20 million, the way the House did it, and it's ARPA, then you have restrictions on what you can use.
But that would might be permissible, I don't.
That's a different 20 million. The 20 million for the housing is already general, it's anticipated general fund.
Because it's already been sent through DSC.
No,
No, because our collections are higher than.
it's
Then
anticipated
there's,
that the revenues for this fiscal year will come in higher than the official forecast.
that's the first.
Oh, and then it was the hazard mitigation, that's the
Yes.
other reversion.
Yeah.
Which
And
is
that
also
is
40 or 20.
For,
Well, we have 40 for the FEMA and municipal mitigation, and then we had 25 for VHCB, I believe, and 25 for VHFA.
yeah, and those are all allowable ARPA
Yeah,
uses,
yeah.
so they wouldn't have to go through the.
Yeah, yeah. Okay. I was giving those two.
It's hard to keep them straight. So we're gonna add the language once we get it. We'll put Grady in charge of that, making sure we do. Salisbury Fish Hatchery. We have already negotiated and we've adjusted in the institution to take the capital bill, the funding for this. Because they have the cash fund, which is general fund. And close that out. Non-emergency, transportation.
So this one, we're still sort of looking into with, this is part of the fiscal note that we have, but we're double checking, but in H62, which was for a House bill related to non-emergency medical transport and some other things, there was.
But you're
this-
talking about Medicaid.
Yes,
All right, non-emergency Medicaid.
yes, sorry, Medicaid Medicaid transport. This is what is required, given that they passed 662, this is the general fund, one-time general fund appropriation required to fund what was in that bill.
My question is, we put money in the budget adjustment. And the problem is the methodology that FEMA utilized, and the providers are finding that it was totally inadequate, particularly for the Medicaid beneficiaries that had to go to like methadone treatment every single day. Or they were doing transports to Boston or whatever, and they were, the reimbursements weren't covering their expenses. Do we need a bill to change the reimbursement methodology?
I'm not sure. That's a good one. Nolan is probably the best person to speak to that bill.
300,000, you know,
Well,
And
it's-
there's something that, there's an appropriation in 2024 for it.
I know,
And then there's this additional money, I think, was to get them through the beginning of the year, and then whatever the bill does. I don't wanna speak to it in detail, because I'm not familiar with it, but does something that. Fixes whatever the issue is, so they only need the money one time for the first part of the year. It's my understanding.
I
We'll,
don't have, I
we'll
don't,
look into it.
I know we have to do it. We know that our public transit providers are really, struggling. And to have a cost shift onto a, publicly funded entity to begin with, my question is, how does this fit with the long-term, correction of the reimbursement methodology? When is that methodology going to be, in place? And what is this being added to? I just wanna make sure it's enough, that's all.
So should we hold that until we,
Well, we know that we're gonna agree at least with what's in here, the question is this sufficient? To address the cost. This is JFO miscellaneous tax bill and tax study.
Yeah, so there is a study included in.
Oh, is that on the wealth tax?
Correct.
That is, you pay taxes on, unrealized capital gains? Well, I'm
It's
gonna hold,
studying that, yeah.
Holding it or zeroing it out?
I'd like to zero it out, maybe, I don't know, I mean, we're already getting testimony, like my local hospital was saying, if you wanna recruit some specialists, pass this bill and they'll never come to Vermont, they'll go to Dartmouth or any other place. Because when you're competing and you've got a professional shortage and you need, some, maybe a neurologist or, whatever, you're not gonna, this has got a lot of implications here. I wanna talk to Lynn Cummings to see if in fact they concur. Cause this is coming out of a bill, and I don't know how many of you have gotten letters from people that say, I've retired here. I do admit that I'm fairly well-to-do, but there's a limit on how much I wanna give to the state of Vermont, so this is not without some collateral impacts. So I'll talk with Ann and see if finance wants to study something. Somehow studying something seems to carry a commitment that you're interested in doing it, and
Interesting,
and
just so you.
I've been getting feedback, even just have the discussion is creating a lot of kind of negative perception about, the state, so. We have to change our logo as a beckoning country. Isn't that what we used to be, the beckoning country? Remember that, Dick? I'll check with Ann. Act 250, I've got to, hold that as well, because that ties into the housing bill and the 250, bill that is coming out of housing. And did we put that on the list that I gave to Heather Ron and Tail?
Probably not.
Yeah, I don't think so.
I don't think so, but we should, because if in fact, her proposal is to do an increase on the property transfer tax for non-residential homes. And,
She had a different study she wanted to do.
yeah, but that would be covered by the revenue that she was, that would come from that tax. Plus it would be. So, I think we'll hold that too, and I'll talk with her. All right, so let's look at one-time transfers.
Yep, so we have a couple of transfers, all of these are included in GovRec and then the House accepts to all of them. I think a lot of these are to deal with, some of them are to deal with, deficits in the funds themselves, so bring them back to balance. That's the case with the fire prevention and building inspection fund and the enhanced 911 board fund. The unsafe dam revolving fund is to help capitalize that fund.
Yeah, the question is how much we can add to it. 213 actually would have added another 1.5 for a total of 2.5.
I know you had a conversation about the military sale of the Burlington Armory and other, but it is not the sale of the Burlington Armory, but the other armory. We utilize this special.
That'd be the
fund
one
for that
where we are.
other-
Yes, it would be.
In Burlington.
Yes, well, they just, it's an old fund that has this antiquated name And that's how they executed the transaction.
But-
So,
And then the Act Two,
Act 250 permit funds,
then
same
a deficit.
deficit issue and the criminal records check. Fund also in a deficit.
The criminal history record check fund. Thought we just did record checks. I didn't know we had a fund for it.
It's a revenue source then for that fund. What is the revenue source?
I'm not sure. I can look into it.
Could you please
Yeah, no, I don't,
remember,
I
I
don't,
thought we just funded the
I don't know.
BCIC.
Mhm.
I didn't know they're getting probably some fine or something.
Probably, but these are just to deal with internal deficits.
No, I understand that, but I don't
Yeah.
curious why they have a deficit. It's like, maybe
Maybe,
police have to charge to get the fund or private citizens.
No, I'll find
Can
out.
you check? Yeah, it's maybe
When you get your
different
fingerprints
agencies.
What about the fee to get fingerprints?
That might be.
oh, that's probably it. Yeah, I know it is, because if you want to
We raised
volunteer at a
that
school.
though, 2 years.
No, this is, like, even if you want to volunteer, go into a
Right.
school,
Okay.
work in be a volunteer driver for public transit, you have to get fingerprinted to make sure that you are, that, so I'm pretty sure
That
that's
may
what
be
it
what
is,
that
and you
is.
have to pay. And I know there was concern, because if you wanted to volunteer for Meals on Wheels and you wanted to volunteer as a Medicaid, driver, you were doing record checks for both, entities, so I'm pretty sure that's what it is.
Probably,
Yeah.
but
We'll find
We'll
out.
find out.
why is it?
Only because say 2063. Yeah, it's a $30 fee.
For
Fingerprinting?
Yeah,
It what?
it's a $30 fee for fingerprinting and. it
Right,
looks like
we
there's no
give that
exceptions.
fee to certain people.
That's why.
And is that why there's a deficit? Are we giving we're giving too much?
I don't know,
We'll find out.
We'll find out.
What happened.
Okay, so, but I think conceptually.
That
we
was the
wanna-
wrong term for giving too much. Are too many people
Oh, okay,
Looks like there's
that aren't
some-
getting charged this fee for whatever reason.
because
we upped the sheriff's fee last year, the year ago. To charge for fingerprint,
yeah,
I think from 25 to 30.
I
Well,
know,
these,
these are just to get these funds in balance.
so we would agree with all of these
I think,
numbers.
and I don't think we're disagreeing, we just are trying to get our memories
Right,
refreshed.
and the only thing that we would, talking about channel, unless we find more information about that, but if we get more money in the dam revolving loan fund, we do it somewhere else, we wouldn't do it here, and transfers. We would do it here.
We increase the transfer
Even if you just did one time, where are you transferring from?
from the general fund. It would be in that D1
Right, right.
section, we'll say from the general fund, and then it will list.
Okay, that makes.
We're gonna have to update these references. I don't think so.
Okay, so I think we're agreeing, maybe we can get our memories refreshed on the, criminal history records check. And, then the only other thing is the extent of which we can increase the, revolving loan fund from the million to up to the 2.5 or somewhere in between. And then, we'll go down to the bottom and then we'll take a break and then go on to more language at 3:00. We'll take a break. So, what we were trying to do is make sure, and people, it's gonna take everybody's memory, but these are the bills that we've passed and we had stripped out the appropriations. And so, the first one was Center for Crime Victims, and this was with a higher ed and the work that they're doing on sexual harassment, the 22,000. I think we would want to do that. The other bill was, I don't know if you, county and regional government, and it was the bill. It was, and I think people were concerned about, the focus on county government. On the other hand, there are a number of models where we have created regional entities, like your regional waste management district, where you've got your communication union districts, where municipalities have come together, not on a county basis always, but on, sometimes, in a regional. So the bill had, 50,000 to look at how those configurations. I know there's concern, are you just if you do it through county government, are you just laying another cost on? But there are other models, and the bill was more than county, it was looking at a regional, concept.
Yeah, but we already have that.
What
We have a
if
regional development.
Joint fiscal, regional planning.
do they get to, do they have to do the work?
No,
or
no,
is
we
it
get contract. So we stripped out the appropriation, we passed the bill, so this is what this is doing, is going back and relooking at, those bills.
I'd call it regional.
I think
That's what
regional is
the bill
actually,
says.
yeah,
The
the
regional.
bill says regional.
Yeah.
Yeah, that's.
And whether it's the pension, I know that, for example, on equipment, some towns, for example, are sharing equipment, across.
Towns in Rutland County that have regional police force.
Not why spend on 50 grand to study.
How we can increase the line.
But
They get along fine.
I would just say, I think there are some things that regionally would fit better. I think to just throw it out regional and not pick out specific things is, it is fraught with trouble. And as you look down. I think law enforcement, definitely there should be some conversation regionally to do. In my area, one of the areas that the really small towns have a terrible doing it is appraisals. And the listers that are in the small towns can't get anybody to serve, they can't get the work done. And so if there was more of a regional thing around that, but I think to just throw it out to talk about regional government, it's just,
I think the study could get into the specific.
Well, fire, little fire departments having trouble even attracting new
Same
firefighters.
day, I think May 11th is actually recruiting, well, it's
So-
firefighters.
my only complaint is you bite off too much and you're not gonna get anywhere.
But I think people are at least saying that on a regional basis, there seems to be greater potential to look
I
at,
think
rather than-
retitling it to regional.
well, so, that was a bill that we passed.
Yeah, I know.
So, this is one time. So shall we, and then at least close it out?
Yep.
Per diems, this is for the.
This was also for a 169, the Excel added a one to make it best 160 and
What
159,
is it?
so. There's a working group also associated with the regional and county governments.
Oh. And it has,
Per diem.
It has $15,000 from the legislative budget
What did you round it?
appropriated, and
nothing
it
else.
rounds,
It says 20,000.
it
Rounds
rounds.
to second.
It's really 15,000.
Just
I think it's just part of the, I guess if you're gonna do it. The streaming implementation, we already
They're about to
acknowledged
give
that.
1.1 million to the TV stations.
No, this is for the tax department, the new tax line. So I know, but we passed the bill and now we have to create the
I'm
ability.
saying no to this.
He's still mad from doing his taxes.
Which one?
Well, I'm damned, my $740 is going to this.
We've kind of crossed the Rubicon on that. I'm closing it out. Executive
voting no.
privilege. All right. We don't know.
And tell the clerk.
Tell the clerk.
Clerk, my vote on that, for item 43 is no.
The clerk isn't clerking right now.
He agrees,
I
so
agree with
two no's.
All right.
Do I have a third? Stars, no. You may lose this.
No, Senator Starr actually got up and gave the amendment for the committee. Yeah,
Oh, you can't vote no then.
We gotta get the money to
Yeah.
pay the.
yeah. So, and don't forget,
Tax and spend star.
let me, let me tell you, all we're doing is recognizing, and so the revenues are more than offset. The upfront, the tax department setting it up, so we're still coming out ahead. But you're debating the original concept of the bill.
No, I'm just debating, I didn't like the tax, I like the concept of funding the regional television networks. It's just, I don't like the tax that was used.
Well, I wanted that it didn't cost anything.
No, I understand the cost of something. I
Oh, we passed the
picked
bill,
wrong
we
tax.
passed the bill, so,
I know.
the clerk has noted your position.
I think, we both voted no on
I think we did in committee.
All right, so now we're down to 213, and I've given, Secretary Moore asked her to please prioritize from their perspective. I've given, Senator Bray, that document, and I said, at this point, we haven't got a final amount, that would be available. This is one time. Remember the,
but
there was, this is their positions. Then there are one-time studies that have to be done, or consultation, technical work that has to be done. And then the other was the dam, like, one time. So this is to fund,
They don't need the dam.
they,
well, they,
Well, we're talking about adding, the governor had $1 million.
the question is how much more we add to the fund. These are, activities that the bill would, have undertaken, and they would be done by, you would have to contract out for them. So what we put in here, just to help facilitate, is what A and R identified in terms of, these one-time, activities. And
can we get what, Commissioner Moore has said, or are we gonna put these on hold till we can?
we can put them on hold. I'd like to have an opportunity to get the feedback from Senator Bray committee. This is not all of them.
But this doesn't have like the dam safety division, the positions.
No, that's base.
Right,
This is one time. This is just one time.
yeah, I'm just.
So, no, and
this
you're what,
what I,
no, I understand what your concern is. Those positions would go into the base.
Yep.
And this is only one thing. So, this would be, I would recommend that we do this if we've got the one-time money to do it. I think having that necessary work done, is really important to look at future flooding and, what we do for mitigation. So I think we've got enough, but if we have to, we can always come back and look at haircuts here. And the other, and that's 310 and other flood impacted communities. And what we know is that the way we wrote everything was, if you got flooded in July, you got something. If you got flooded 4 days later in August, you got nothing. And this is to treat this communities, the same way as the July, and these are designated, these are the FEMA designated, communities. And so, from my perspective, it's hard to say, we're giving you something, and 4 days later, you got something equally as bad, but we give you nothing. So this would be, added to the 12.5 that we did for those, mitigations and recovery grants. So
It would all be the FEMA match,
it would be a combination, it would be the same methodology that we use for the other communities. It would be, both the public loss as well as the, personal, yeah. And this is the best estimate that we've got at this point. No, I feel it in fairness, it's hard to say, too bad you're 4 days late.
Yeah.
So,
Well,
well, just because your community made it in July, you probably have a different perspective.
if we didn't spend quite as much up in
No,
section southern, it would have given us a lot more money to spend on things that might produce some positive action.
you think that's a lot, you can see the bill.
Do you want to say anything about the hardwood?
No, it's just, we were using estimates in terms of the community
But
impact.
hardwood was incorporated in what we did before.
It was, but unfortunately, they forgot their wastewater.
No, I understand that, but, were they, they got added back in though, and it just reduced everything
Only
else.
by chance that we discovered that that was not included by error.
But that, I mean, that's fair, I mean, they belong in.
So it's 3 o'clock and I'm gonna suggest we take a break until 3:50 and then we're gonna start walking through language.
And so our committee is looking at some of the things that were on the list from the public hearings that are not included in the budget. We're also looking at some of the bills that are passed out or are in the committee. But we'll look at, I'm gonna try to have us look at those things that were mentioned at the public hearings but weren't included. And then we can address perhaps some of the priorities that we have in committee. We'll also look at the bills that we're passing and we may or may not make comments about those. But when we pass a bill, that's a priority, so it's why would we say it again?
Well, if we
I just list the bills that we pass. And some of them we haven't passed yet. For example, 171, which we know about, and then the GA bill, which is
well,
a couple of.
and then ultimately we have to determine what we want to do. Some of the appropriations are gonna any appropriation.
We got it.
It's gonna travel in the.
Well, some of these bills also have financing sections.
Doesn't matter.
I know, so they've got taxes and appropriations, so we'll be looking at that as well.
The tax to me will be driven by the amount we determine that we feel we.
I understand that, and currently the House is.
And I'm not saying it for you, Ginny, I'm
No,
saying
no.
it for everybody
Oh, we all
around
know
the room.
Everything that, there are a lot of things that are already funded in the budget that are in the bills that have come to us from the House.
Yes.
And we understand that's all fluid.
And we've gone through, the budget and there's some, for example, the 300,000 that was requested for, post-adoption support. And so there's some complications as it relates to that because we thought we had done, an increase and the way it worked didn't work. So, there's some things that we're gonna be working on to figure it out. So we did go through, but absolutely go through because everybody's gonna say, did you remember this? And did you remember that? And there's only so much,
We can do.
no, there's only so much I feel comfortable that I can rely on my memory as well. And that's why we're trying to go through this, and I'm sure anybody, who's got a question or feels that we've missed something, with just a reminder, the extent to which we can address it. I mean, VSEA came in with their wish list just now. The question becomes one of looking at all and across. So I'm gonna